Hello and welcome to another episode of the Cycling Physios, where we aim to develop your knowledge and skills in supporting cyclists of all levels. Whether you are a medical professional, bike fitter or both, we have a wealth of resources to advance your practice. My name is Tim, and in the background controlling things today is Bianca. Today on the show we're joined by Cliff Eaton from Compex. Now, if you're not familiar with Compex, these people are the world leaders in portable muscle stimulators, which can help improve performance and recovery in sport. Their parent company, NMES, also have a range of medical devices, but we recognise that many healthcare professionals also use the Compex devices in rehabilitation. So additionally, they've also got a range of braces and massage guns and compression boots that can help support athletes in their training and recovery. But before we get into today's presentation about Compex devices, Cliff, do you want to just tell us a little bit more about who you are and your involvement with Compex?
Yeah, thank you, Tim. It's been a pleasure to receive this information to talk with you today. Look, I'm a chartered physiotherapist, and my clinical career has been working in elite professional sport, including rugby and soccer, where I use Compex alongside our strength and conditioners, and also within my rehabilitation. And I've been doing that for about 12 years ago, I was approached by NMES looking for a trainer on Compex to ensure people who had invested in the device were getting the best out of the product. So I sort of started to wind down my clinical career and spend more and more time doing that. And then, as you said, NMES have a range of medical devices. So about 8 years ago, they split the medical devices into the Chattanooga range and kept Compex as the more of the home use, if you like, and for the weekend warriors. Compex is still considered the name in electrical stimulation, a bit like Hoover is to vacuum cleaning. So yeah, that's effectively my role.
Cool. Okay. So yeah, do you want to tell us a bit more about sort of what these devices are and how they can potentially help?
Yeah. Well, if I can, I'll start, if I may, with a short presentation, and then we can discuss through it. So Bianca, if you could show. Okay, I've got it. No, previous slide. Sorry, I didn't appreciate we're on the first slide. Okay, so to commence our podcast, I'd like to introduce exactly what muscle stim is. Electrical stim is simply a way of enhancing cyclists with their performance, whether that's strength or endurance, and also their recovery. Because training today is all about training less, but training harder and recovering smarter. Now, as cyclists, and I include myself here, we tend to spend quite large amounts of money ensuring that we've got the lightest frame with the most aerodynamic wheels, with the best gear set, and even down to clothing. But my question comes, what about the engine? The engine is you, and I don't feel we necessarily pay enough attention to that. So if we move to the next slide, please, Bianca. So all muscle stim is, or electrical stim, is an artificial way of creating an action potential. Now, an action potential is a signal sent through the nervous system to stimulate a muscle. And the impulse used in a Compex device, 98% mimics that sent from the brain. So a muscle or muscle group doesn't know or indeed care whether the impulse is coming from a device or the brain. Is just going to react to it. Well, next slide, please. So the very clever thing about all of this is that if we change the frequency of impulse, we can have different effects and different physiological effects on different fiber types. So we can place emphasis on type 1 aerobic endurance fibers. So that's obviously a benefit to an enduro rider. Or on the other end of the spectrum, we can place emphasis on type 2B anaerobic fiber types, which might be more in keeping with the training of a time trialist, for example. Okay, so let's move on to the next slide. So on a device, you haven't got to worry about changing different frequencies because the manufacturers just put names to them, basically, and also adapt the work to rest periods to suit. So, for example, if we look at the endurance program, now the idea of that is to improve the oxidative capacity of the stimulated muscles. And indeed, with prolonged use, it's been shown that we can actually change the phenotype of muscles. So the endurance program targets type 1 muscle fibers, and the work to rest reflects that. So you will work for 8 seconds, but only be given 2 seconds recovery before the muscle is asked to work again. And then you compare that to the resistance program, and this is more working on the lactate threshold of the muscle, increasing strength endurance. So here you'll see that it's a different frequency, but the work to rest times are equal. Now with strength, that's where we're working on those type 2B muscle fibers. They're anaerobic in nature. And you'll see now that we're going to work for a very short period of time, 4 seconds, and then have a much longer recovery time because we have to then go through the Krebs cycle to replace the ATP in the cell. Okay, so let's move on to the next slide. So conditioning programs. Capillarization does not create a tetanic contraction in the muscle. It's what we call a twitch. So anything under 10 hertz, 10 impulses per second, a muscle can switch on and off quickly. So we refer to that as the muscle twitching. And what we can do in that situation is one, and we'll look at this when we talk about recovery, is to promote lymphatic drainage after training to get rid of things like lactate. But again, with prolonged use, we can actually increase the capillary beds within a muscle group, and this has been shown with biopsies. So makes the muscle much more resistant to fatigue. So again, something I would incorporate with enduro riders. Now, potentiation, that's a very interesting one because I have worked with professional cycling teams and some well-known British time trialists. This optimally you use within 10 minutes of starting a race. So that could be a time trial, or if you're a cyclist within a velodrome and you're doing a speed event. The idea behind it is to fire up the central nervous system. So immediately from the start, the muscles are working at maximum capacity. And unlike other forms of preparation for this type of event, it doesn't place cardiovascular demands on the athlete. Okay, we move on again. So then we move to recovery. Now, Compex is used by a lot of professional riding teams. It's part of the preparation recovery, in races like the Tour de France, for example. In that situation, the riders are using the capillarization program on the team bus from the time they leave the hotel to the start of the stage, again to prepare the muscles without putting cardiovascular constraints on. But after the race, after the stage, obviously they've got to start preparation for the next day's stage. And that starts immediately they get on the bus back to the hotel. And they're using compression devices and cryotherapy combined with Compex. Now, this study that I've shown here compared 3 recovery methods typically used, like passive recovery, things like deep tissue massage, active recovery, where you might, be in a pool or you'll just cycle slowly, or electrical stimulation. And what they found with electrical stimulation was the blood lactate levels decreased significantly from the pre-measurements compared to the other 2 methods of recovery. And also the perception of recovery within athletes was superior in the muscle stim, and the passive recovery group. So the findings suggest that muscle stim is a very effective recovery method post competition or training. Okay, next slide. So putting my physiotherapy hat on, look, we know, I've worked with cyclists, we know that they can develop imbalances in the quadriceps muscle, the vastus lateralis can become more dominant, the vastus medialis, that can result in maltracking of the patella, and we get patellofemoral pain. Now, from a physiotherapy point of view, we know it's very difficult to isolate a muscle within a group. And that is where I use muscle stim, because I can put muscle stim on vastus medialis, do the same type of rehabilitation exercise. It's not a replacement, but you use it in conjunction with your favored exercise, vastus medialis, and you will enhance far more, you'll get far more recruitment of the muscle fibers in that compared to the other muscles of the quadricep group. So you can start to address those imbalances. And if you want to, I've put a link there for anybody who's interested. There's a very good YouTube that demonstrates that for you. And if this video works, hopefully, when we press play, we'll see a quick example of how it can be used.
So here we have the athlete positioned on a bicycle where we have Compex on his quads, and the idea here will be to increase intensity during a contraction stage, which are happening right now, and keep going, and I can increase intensity here and then stop and slow down, and then during the recovery phase of the cycle we get the athlete just to slow down. And again, what we're doing here is we're firing and we're asking for all of the muscle fibers to contract during the exercise, as opposed to without the Compex, where this wouldn't be the case.
Okay, so that concludes my talk. Let's or the presentation. Let's discuss some of those things.
Yeah, so I think the question is, how would either a physio working with an injured cyclist use this as part of that management? And you touched on a few points there already about maybe helping isolate particular muscles. I mean, I've used it where an athlete is maybe struggling to kind of feel the particular type of movement of exercise. Maybe it's, for example, feeling how to sort of engage their trunk and the sort of core muscles, if we use that phrase, core, to feel how they should be stable on the bike. Used it in that example. Or somebody that's very, very quad dominant on the bike and we're wanting to get a little bit more posterior chain engagement. Again, using it there. That's been effective in the past. Bianca, what uses have you used in the past in terms of maybe with that sort of bike fitting physio hat on?
Yeah, I think probably the same as you, Tim, because Cliff, both of us work in a bike fitting but also a physio capacity. So for me, this is something that I would use quite often with athletes in that acute phase. You know, when I know and I'm thinking, do we want to change their bike position to try and retro benefit their symptoms, or actually should we approach things differently? And yeah, for me, this is kind of one of my go-tos, definitely, if they're really struggling with a lot of inhibition, pain, they've crashed, all sorts of things. But I mean, a question for you, Cliff, probably would be, how soon do you think you should start using Compex post, let's say, patellofemoral pain, or let's say there's been a crash, developed patellofemoral pain, structurally they're okay. How soon would you start using Compex, and would you start using Compex straight away for those athletes?
Yeah, great question. And my answer is as soon as possible. Because any sort of trauma, you can develop, as you know, arthrogenic muscle inhibition. So it's just nature's protective way of stopping us moving these muscles, so we don't cause further damage. But then it can have sort of long-standing negative effects. Okay, sorry, I think I'm playing a little bit. So yeah, the earlier you can start, the better. Okay, so I know, for example, in orthopedic wards post-surgery, they're using Compex as soon as the patient comes back onto the ward. And then, Tim, can I pick up on a point what you said about core, because this is a great one, because cyclists' core is what I mean by core is obviously firing up the spinal stabilizers like multifidus and transversus abdominis. Now, the question that was asked was, well, can muscle stim fire up transversus abdominis when it's got to go through things like internal external obliques? Now, Coughlin used ultrasound imaging and demonstrated that it could, that actually did happen. And then BAK, they confirmed those findings with ultrasound imaging, but they also played around with the position of the electrodes and found the most effective place is to put your reference electrode just underneath your bottom rib, and the second one just in from the ACIS on your hip, where we generally palpate for activation of transversus. So again, for cyclists, I've used that a lot. You know, if I look at a cyclist and mechanics, and I see the whole sort of body trying to generate power, then I use Compex to work on their core to stabilize.
And here's an interesting consideration, Cliff, because I mean, I'm guilty of using this much more for lower limb than I am upper limb. But we know that clavicle fractures are one of the most common injuries to professional cyclists. How might you apply Compex to those kind of situations?
So in that situation, as you know, as soon as we get pain, it has a detrimental effect on stabilizers. I don't want to say they switch off, because the stabilizers never switch off until the end comes. But we know the timing of the stabilizer. So in that situation, you know that your scapular stabilizers are going to be affected. And the current thinking in rehabilitation now is not to recruit these stabilizers in the conscious part of the brain, which, you know, I'd say we're guilty of, but that's as physios we tend to do, using visual cues and tactile cues and auditory cues, etc. But when we're out on the bike, we're not sitting there with them, reminding them to set their scapula. So there's a big move now, and it was started by Ben Jasmins in 2015, did a good study, looking at using what they call external focus to learn these movement patterns in the subconscious of the brain, so that when we go back to our sporting event, we retain it. So muscle stim's really good for that, because it's telling the brain, look, if you fire up your scapular stabilizers first, and then you abduct your arm or whatever, you don't get pain or whatever. Sorry, long-winded answer for a short question.
No, it was great, because I think this is the thing, you know, probably one of the big barriers to using Compex, certainly from my experience, is people go, oh, I don't know how to use it, and oh, I'm worried that I'm going to cause harm to that patient by using it. But actually, you know, the sooner you get it on, you're trying to, you know, reverse, as you say, some of these kind of negative consequences of injury. But
Yeah.
I guess in terms of using it clinically as well, as you say, you make a good point about get it on ASAP. What advice do you give to physios for electrode placement? Because how Tim and I do it might be different to how people kind of do it when they're watching. Like, have you got to be really specific about where you put it? What happens if the electrode is kind of bigger than the muscle or it overlaps? Is that optimal from your perspective?
Okay, another fantastic question. And this comes up a lot. Look, if we were to put 2 electrodes on a muscle, it's going to contract, okay? But not necessarily efficiently or more importantly, comfortably for the patient. The best place to put your electrodes is one, put your reference electrode at the top or indeed bottom of the muscle group, just out of the way, because within that muscle, the selected muscle that you want to work, there'll be something called a motor point. It's where the motor nerve pierces the fascia into the muscle. Now, the most effective and comfortable place to put the electrode is over that motor point. So premeditating the next question, where's the motor point? The anatomy books tell us that they normally occur at the distal 2/3, the distal, the superior third to the distal 2/3 of the muscle. But as we know, mummies don't read anatomy books. You're provided with the Compex device with what's called a motor point pen. So before you put your electrodes, you use this motor point pen over the muscle. It identifies exactly where the motor point is, and that's where to put your electrode. Now, with regard to size of electrodes, the bigger the energy is coming out, okay, of the device. And if you're going to spread it over a larger area, again, it's going to be far more comfortable for the patient, and indeed, arguably engage more muscle fibers. But we don't want it to overlap with other muscle groups. So if you're targeting vastus medialis, for example, you don't want a large enough electrode that's also going to fire up vastus lateralis, because then you're not addressing that imbalance. So a question of size is about specificity, really, and size of the muscle group you're working with.
And the advantage of the Compex devices, particularly the higher spec devices, the sort of SP8, for example, is they've got the My Scan, where they will actually adjust the intensity. So the good thing there is actually if you don't get it quite right, it will adjust the intensity to still give an optimal intensity of electrical stimulus, won't they? So it's one of the advantages of the Compex devices versus other ones on the market.
Exactly. It's look, you know, I worked in professional sport. I won't say money was no object, but I could ensure that I was getting the best devices. And yes, so the MI technology, which is unique to the Compex range, which they also incorporate in the Chattanooga medical device range, it should be said. But has this MI technology. Now, what it does when you first start a program is to scan the muscle to identify what is the best settings for that individual on their muscle at that time of the day. Without going into too much detail, but the physios might well have heard of chronaxy. Chronaxy simply means that the minimum pulse width with the minimum intensity to get an actual potential. That's what we want, you know, to ensure comfort for the patient. But it's a variable. It varies between individuals. It varies between muscles, but can also vary during the day. Now, if a patient comes to you and they arrived a bit early, so they stopped off at Costa Coffee, other coffee brands are available. You know, it's a stimulant. Coffee's a stimulant to that that heightens the excitability of the central nervous system. And equally, if they come to you at the end of a training session a bit dehydrated, that suppresses the central nervous system. So that's a variable. What the device does by measuring that chronaxy is adjust the settings automatically to ensure that we get the optimal settings for the patient at that time of the day.
What do cyclists tend to say they prefer? Do you know if you're kind of aware of the comparisons of that? Because obviously we can, well, some research studies are cool and we can look at blood lactate, but it's always a case of comparing things a little bit more clinically, a little bit more superficially, and a little bit more on the kind of, how does that feel?
No, that's fine. No. Look, I also was privileged enough to work with some very high-end triathletes and world champion duathletes, and I asked this very question. And I mean, if you're a non-professional and but you're if you're a keen triathlete, you know, at the end of the event, there's a big long queue for the massage tables. Okay? What you'll find now at more and more of these events is a Compex stand, because people can come in and they don't have to wait. It's much more convenient. Or some triathletes are even just using it. You know, they're getting into the car, plugging themselves on the machine and driving home. So it's a lot more convenient. Now, from a professional standpoint, I worked in team sports, and after a match on Saturday, the preparation for the next weekend match started immediately afterwards. So once the guys had their showers and something to eat, we got them on the coach, and then I had several of these units. They're 4-channel, so I could put 2 channels on one player and 2 channels on another player, and I could do the whole team. So recovery started on the team bus on the way back, and you saw that with the professional cycling team. They do that as well, because they know, you know, the science has shown that that's the best form of recovery and the best way of preparing them for the next stage tomorrow.
From a travel point of view, I mean, that's my portable travel case for my Compex. So, you know, in there, I've got my sensors, I've got my SPA. And you think about the size of that versus my case for my compression boots, significantly, you know. So when I'm racing internationally myself, you know, that goes in my carry-on bag. I don't take my boots with me because they're too. I'd like to take my boots with me, but yeah, they're too big. But I think we sort of put it back to maybe although we know there's going to be cyclists listening to this, coaches listening to this, our intended audience is primarily the therapists, the physios, the rehabbers, with that sort of bike fit interest as well. So it's maybe how do they incorporate Compex into their clinical practice? So they've got maybe an injured cyclist coming in. So we've thought about maybe acute injuries. I mean, I personally have had my Compex on and working within 2 hours of an acute injury in the past, really just trying to help speed up that process. There's obviously also the pain relief settings. You know, you can use these devices as a TENS machine, and there's that benefit as well. I think it's maybe just trying to think about some of those more challenging bike fit scenarios where we're trying to work with a rider, and it's always that debate. So our bias in sort of Bianca's practice and my practice is we're often working with those slightly more complex cases where it's that debate of, are we fitting the rider to the bike, or are we fitting the bike to the rider, or is it a little bit of both? And it's not always about just changing the bike setup. Sometimes it's about working on the rider off the bike to improve their ability to then adapt a position on the bike. So I'm just thinking back to maybe some other examples that I've had in the past regarding sort of lower limb injuries. And Bianca, I know obviously our bias is maybe thinking about lower limb rehab, but even just things like the calf and pedaling action through the calf. And, you know, I've had people in the past with, you know, a calf injury, and they're struggling to then actually engage properly to get a more stable platform through that pedal stroke. rather than then dropping the heel and putting pressure through that calf injury. So we can use that just to artificially give a little bit of extra stimulus to that muscle contraction.
And I guess arguably as well, I don't know how much you're kind of in the kind of bike fit world, Cliff, and what you might have done positionally, but there's a strong fatigue component as well sometimes to athletes. As Tim said, if you're like, well, where do we start? Do we start with you, or do we start with the bike, or do we start with both? And obviously when you're adapting to something, you'll fatigue. So I guess there's the application of Compex there as well from a kind of neuromuscular point of view in terms of, you know, can we improve that person's longevity, improve how they can adapt as well to positions by implementing Compex? I think that's a really useful strategy to consider. It depends what's within the confines of your clinical time always, isn't it, and what your priorities are. But for me, like, I think that's one of the invaluable things as well. It's not just about the recruitment, it is about the endurance component of it as well.
Add another example. I had a professional cyclist who broke her ankle, and worked with a strength and conditioning coach and worked with the physio, but couldn't address this imbalance. She still had a bit of weakness on her affected side compared to the unaffected side, and so I introduced them to Compex, and she used it on a watt bike. So that we could see the difference, and within 3 sessions of utilizing Compex on the watt bike, she got parity to the other side.
Yeah, I think that's a huge part of it. If we are seeing a significant asymmetry, and we know that we're not chasing perfect symmetry because there's no such thing, but if we see a significant asymmetry with somebody's pedaling action on the bike, and we've identified through our off the bike assessment there is a significant strength asymmetry, exactly that's where we can bring in these devices, because yes, we can be just loading them with their rehab exercises or their gym program to try and balance that out, but absolutely is bringing in a device like this can just accelerate that. I'm trying to remember the name of the paper, but I briefly read it earlier on this week, which was just showing that actually utilizing the electrical stim alongside the endurance exercise, you can, in the similar ways that we know about with blood flow restriction, is you can get a strong response with a lower load. So particularly in that sort of injured athlete who maybe can't do the volume, we can incorporate the muscle stim in the same way we know we can incorporate blood flow restriction training to still get a strong response, but with a lower load on those tissues, can't we?
That's correct. Yeah, the study you're referring to is by Palliard et al. And yeah, as you say, you don't have to put huge demands on the tissue. You can get the same effect with low loads, but incorporate muscle stim.
Yeah, exactly. And again, if there's people listening to this who are, maybe more very much in that rehab world, you talked about orthopedics and post-op work. We know there's a wealth of literature on things like ACL reconstruction and using muscle stim in those early days to minimize that atrophy. Or again, after total knee replacement or other orthopedic surgery, using this very early in that rehab phase to minimize that atrophy can then again accelerate the recovery process, because we're not starting from therefore a much lower level once the initial trauma of the surgery has passed. So yeah, and obviously we know that cycling is a big part of rehab from orthopedics, even if it's just cycling in the physiotherapy gym rather than managing a cyclist. Understanding how we can incorporate this as part of maybe a cycling rehab program is also really, really beneficial. That's a research interest of mine.
Yeah, and traditionally, if the physiotherapists don't mind me saying this, Those of them who have incorporated muscle stim tend to use it sort of immediately post-op, or when a patient is immobilized, they can't exercise. Now, what I've been advocating for many, many years is that if you combine muscle stim with active exercise, you get far superior results. And what's nice for me now in the last few years is we're getting all that research evidence that you've alluded to, Tim, supporting that. That's what they're telling us to do now. Combine with active exercise, not replace, combine.
Yeah, that's it. Yeah, and it can be passive. There's certainly research showing the use of this in like intensive care and medical wards, but that's not really our market that we're thinking about. But absolutely, it's about combining this with exercise as well, as that combination rather than isolation. So, okay. Conscious of time, Cliff. So if there are sort of therapists, bike fitters who are thinking, I'll be interested in incorporating this into my clinical practice, and they're not at the moment, where can they go about looking at sort of contacting Compex? There's obviously the trainer courses to become a registered Compex professional. So how could somebody go about getting in touch with the company and exploring this further?
That's a great question, because I'm not involved in sales. But there is something called the ChattanoogaRehab.com website that has all the devices on there with prices, so they could buy it online, or contact numbers to speak to somebody. I think I've actually done online courses which are available on the NMES Academy as well, as well as YouTube, because I'm conscious that if people making an investment in this type of device, they've got to, you've got to have full benefit from it. So those resources are available to people. So I would suggest first port of call was the ChattanoogaRehab.com or Compex.com.
Yeah, and then for our local rep is Helen. So if anybody's in the UK, then I can put you in touch with Helen. But for our international listeners, then
Helen Cartwright, excellent.
Yeah, that's right. So I can put you in touch with Helen, or internationally, then we'll find out who the best person is for you to maybe liaise with. Bianca,
each market has a Helen Cartwright. So
Bianca, is there anything else you want to add in terms of experience or recommendations for our listeners?
No, thanks, Tim, and thanks, Cliff. I think that's given a good kind of insight into the use of Compex, because certainly I know electrotherapy is a slightly controversial modality in physiotherapy sometimes. So I think it's a good start, and hopefully it makes people just think out there, how might you use this, because as you guys point out, there's a big evidence base in it, and it's a really underused modality.
That's it. The neuromuscular electrical stim is got good evidence behind it, as you're correct in saying. The other maybe electrotherapy devices that are out there, there's maybe more debate over their usefulness, but for the muscle stim, there is good evidence to support its use, as Cliff mentioned, as part of additional rehab. It's not in isolation. So thank you, Cliff, for your time today, and raising people's awareness of these devices. Just giving a little bit of a background there. So if you do want to find out more, there are, as you mentioned there, you have got videos on YouTube educating users in how to use the devices, and also videos for professionals on how to use it with clients. And there are obviously the further training courses to become a recognized Compex practitioner, so that you can be recognized in your clinical practice for that. So if that is something of interest for the professionals listening to this, I would encourage you to explore that. And for the athletes listening to this, then again, have a look on the Compex website, have a look on the resources there. And like I say, this is something that could be beneficial to support your training and your recovery. Yeah. Okay. Anything else you want to add in, Cliff?
I'll finish where I started, if I may, guys. Remember, the current concept now is to train harder, but train less and recover smarter.
That's it.
Thank you.
Excellent. Okay, thank you very much for your time, and we look forward to another episode coming up shortly.